Greetings to all honorable judges of International Postgraduate e-Symposium 2021, fellow participants, and everyone here. Thank you for having me today. My name is Lai Ting Wei, Master of Science student under School of Dental Science, and today I would like to present my preliminary study of interleukin 6 and protein-induced vitamin K absence 2 PIVCA2 levels among hepatocellular carcinoma patients in hospital USM. First of all, let me introduce about hepatocellular carcinoma or HCC. HCC is the most common primary liver malignancy worldwide, and sadly it is always diagnosed late due to the limitations of current surveillance tools. According to Globocon 2020, HCC is classified as the sixth most common newly diagnosed cancer and fourth most common cause of cancer death worldwide. While in our country Malaysia, HCC is the eighth most common cause of diagnosed cancer among Malaysian and sixth most common diagnosed cancer among Malaysian male, according to our National Cancer Registry 2015 report. And for etiology, hepatitis B is the leading cause of HCC in Malaysia, followed by cryptogenic cause and hepatitis C. Current HCC surveillance only approve ultrasonography as the method of choice. Ultrasound can achieve a sensitivity and specificity of 94% for all stages of tumor. However, its sensitivity drastically reduced to only 63% for early stage HCC. And ultrasound has a lot of limitation, whereby it's influenced by the experience of the operator who performed the ultrasound, the quality of the machine itself, and also the underlying liver condition. For example, patients with fatty liver disease might have obscure ultrasound finding. Next, we have serum alpha-fetoprotein. Alpha-fetoprotein is a traditional tumor marker for HCC that is widely utilized by clinicians all over the world. However, it is never approved by any guideline for HCC surveillance due to a lot of limitation. There is up to 35% of early stage HCC show normal serum AFP, and serum AFP is also elevated in benign liver disease, for instance, chronic hepatitis. And at a cutoff value of 10 nanogram per milliliter, serum alpha-fetoprotein only achieved a sensitivity of 78.9% and specificity of 84.6%. Here, we would like to introduce two potential HCC serum biomarkers. First is interleukin 6, a pleiotropic inflammatory cytokine that has multiple roles in terms of regulation of immune response and hematopoiesis. In relation to HCC, IL-6 promotes multiple stages of tumor development, while in another hand, PIVCA2 is an abnormal prothrombin generated by malignant hepatocyte, and this PIVCA2 does not possess any coagulation activity. Next, we have picture here to show us the relationship between interleukin 6 and PIVCA2 with HCC. Interleukin 6 is involved in the microenvironment of HCC. It is produced by Kupffer cell in response to hepatocyte damage, while PIVCA2 is secreted by malignant hepatocytes in the absence of carboxylase-dependent vitamin K. In view of the clear relationship between IL-6 and PIVCA2 with HCC, we would like to propose the potential of these two serum biomarkers in terms of HCC management. For study objective, we would like to determine the levels of interleukin 6 and protein-induced vitamin K absence to PIVCA2 among HCC patients in hospital USM and their sensitivity and specificity. This is a prospective cohort study started from 1st January until 31st December this year. Subjects is divided into two groups. Group 1 were 27 HCC patients received treatment at hospital USM, while Group 2 were 36 healthy subjects without any known or family history of malignancy. Both groups were venous blood samples were collected and sent for measurement of serum interleukin 6 and PIVCA2. The blood sample was centrifuged at 3000 rounds per minute and stored at negative 20 degrees Celsius before analysis. And for measurement of IL-6 were measured by electrochemiluminescent assay via Cobas 6000 automated analyzer, while PIVCA2 was measured by chemiluminescent microparticle assay via Architect Plus analyzer. Upon gathered all the results, our data analyzed via SPSS version 26 and descriptive statistics were displayed with median and interquartile range as our sample size is small and non-normally distributed. And intergroup difference were evaluated using Mann-Whitney test. Diagnostic performance were compared using area under ROC curve and specificity and sensitivity. And our study already obtained ethical approval from JPAM. Next is the most important part of my presentation, that is my results. For demographic data for gender, as we can see here, both for HCC subject and healthy subject, most of the subject were male. For HCC subject, 77.8% were male, and for healthy subject, 69.4% were male. And for race, most of them were Malay. Malay stand for 8.9% for HCC subject, and almost 100% of my healthy subject were male. And for comparison between IL6 between HCC and healthy subject, HCC subject show highest median interquartile range at 39.8 compared to healthy subject at only 1.6. And our result is statistically significant as the p-value is only 0.03. Since go to PIVCA2, HCC subject has higher median at 349.79 compared to healthy at only 24.23, and p-value is significant. Our result is significant as p-value is 0.03. And for area under ROC curve, red line here show PIVCA2, blue line show Interleukin 6. Both were above 0.5. However, PIVCA2 is 96.7 and IL6 is 85.2. Hence, our result shows that PIVCA2 has slightly better diagnostic performance as compared to IL6. While for diagnostic performance, PIVCA2 show higher sensitivity, specificity, positive predictive value, negative predictive value as compared to IL6. For discussion, both IL6 and PIVCA2 can differentiate HCC from healthy subject. And for IL6, our finding is in agreement with an Italy study in 2007, whereby it shows that serum IL6 is higher in HCC patient. And for PIVCA2, our finding is same with Sharma et al. 2009, an Indian study, which also showed that PIVCA2 is higher among HCC patient. And for diagnostic performance, our study showed that both PIVCA2 and IL6 can be potential tumor marker for HCC, with serum interleukin 6 have lower sensitivity and specificity. And our finding is inconsistent with two China study, Huang et al. For PIVCA2 and Xia et al. For interleukin 6. Thus, in conclusion, both serum IL6 and PIVCA2 can be good tumor marker for differentiate HCC from healthy subject. However, our study concluded that serum PIVCA2 is a better tumor marker at a cutoff value of 40 mAu per milliliter. And this is my references. And for the completion of my presentation today, I would like to acknowledge my main supervisor, Dr. Nokaryati binti Kashim, co-supervisor Professor Dr. Lee Yong Ye, Associate Professor Dr. Julia binti Omar, Associate Professor Dr. Muhammad Shafi'i bin Abdullah, and Associate Professor Dr. Wan Muhammad Amir. And also not to forget, our study received short-term grant from University Science Malaysia. That's all from me. Thank you.